Good morning, I am Dr. Aman Salwan here. I am a senior consultant intervention cardiology at Care Hospital, Nampally. Today I would like to tell you in brief about heart failure. Now what is heart failure? Heart failure is that normally our heart has a capacity to pump blood adequately to supply the needs of the body and the other organs. Now suppose somebody has had a heart attack or he has developed some disease which makes the heart muscles weak. That is called heart failure with reduced ejection fraction. Normally the ejection fraction is about 60% and this is determined most commonly by doing an echocardiogram. So if somebody has a ejection fraction of say 30, 35, 40%, then this is not adequate for him to maintain the needs of the body when he is running, exercising or doing activities which are more than the normal activities. So such people can develop breathlessness and sometimes they can go into heart failure with water coming into their lungs, which needed to be treated urgently by hospitalization. On the contrary, some people can also develop heart failure with a normal ejection fraction, that is called heart failure with preserved ejection fraction. So these are patients whose heart has become stiff because of causes like uncontrolled hypertension, hypercholesteremia or various other diseases. So the heart has two stages, one is the heart contracts and the other is the heart relaxes. So the heart failure can be a problem because of the reduced contractibility, or it can also be possible to have a reduced relaxation. So even when the relaxation is not proper, the heart will not fill properly and the venous pressure in the lungs will rise because of a back pressure, and this can also lead to heart failure. And also if some people have very stiff muscles, hypertrophic muscles, these people can also, because the heart has to overwork, this can also lead to heart failure. So heart failure is a large thing. You can have heart failure because of low ejection fraction, even normal ejection fraction. So what is the treatment? So the treatment has to be according to the cause. If there is an identifiable cause which is causing these muscles to be weak, like a coronary artery disease, and you get a surgery done or you do angioplasty done, in some of the cases once the blood supply to the heart muscle improves, the heart pumping may actually improve. There are other cases like dilated cardiomyopathy. If you are about to, some of them are even reversible, like some viral infections are there. Some ladies during the last stages of pregnancy, that is called as the peripartum period, they may develop weakness in their heart muscles. Many of these patients may recover with medications and some of them recover spontaneously also. So you have to have a close follow-up on such patients. And then you have nowadays very good medications for heart failure, and there is a large range of medicines. At least there are 5 or 6 medicines including beta blockers, and now you have sacubitril, valsartan kind of drugs and diuretics, nitrates, which all help in these patients of heart failure. And now we have certain special pacemakers called CRTD, that is called cardiac resynchronization therapy. So some of the people may be eligible for these kind of pacemakers, although they are expensive, but if you select the patient correctly, there is an improvement in ejection fraction and the patients will definitely have a better quality of life. And last but not the least, there is also now in care hospitals, we have the facility for cardiac transplantation, and we also have certain left ventricular assist devices which can help patient with severely who have very severe LV dysfunctions, whose heart pumping is very poor. So these patients can either be fitted into the left ventricular assist devices category, or even the cardiac transplant program is very active, and once they have a cardiac transplant, now the results are very good even in India, and people are post transplant living 5 or 10 years without any major problems if they are following up properly. So I would just like to give this message that heart failure, even with a very bad left ventricular ejection fraction, is a treatable cause now. We have multiple modalities. So you should approach your doctors and try and find a cure for yourself and lead a much better quality of life. Thank you.